Brazil, now the second hardest hit country in coronavirus cases after the U.S., has more than 23,000 deaths. But some experts suspect the real number is even higher.
Today in Brazil, we have around 300,000 cases. And perhaps we have 12 times more.
Hi, I am Dr. Daniela Gomes. I am a visiting assistant professor of international studies at Reverend College, and I am here today to give you news about the COVID-19 in Brazil. Brazil is nowadays the epicenter of the COVID-19 and the coronavirus spread. We have more than 390,000 cases, confirmed cases of COVID-19. These numbers are not 100% real because they are only testing severe cases. So we probably have much more people who are contaminated by the coronavirus and went back home without any treatment. We have more, of course, than 125,000 people who recovered from COVID-19, and we have to share those news because they are special. However, we have more than 25,000 deaths because of COVID-19. In addition to the pandemic, Brazil faces another serious issue, which is hunger. More than 10,000 Brazilians live under the line of poverty. That said, with the situation of the quarantine and the close of a lot of business, a lot of Brazilians are unemployed. Also, many Brazilians have been working informally since our economy is not recovering from these past years of political instability and economic instability. So we have, on one hand, people who need to stay home because they have to keep themselves safe. But on the other hand, we have people who are concerned about what they are going to eat tomorrow and are actually depending on groceries that have been given to them by church, by religious organizations, by NGOs, by social media campaigns. So those problems are very serious. Why I highlight those? Because the pandemic, in addition to poverty, make some populations of Brazil more vulnerable to COVID-19. One, we have the indigenous communities of Brazil, more than 800,000 people who are highly affected by COVID-19, especially because there is no health care plan specifically to those communities. Some of those communities are very far from a hospital, right? Are isolated, so they don't have a lot of resource there to combat. Same thing with Quilombo communities, where people are getting sick and they don't have the necessary treatment to avoid. The same we can say about the favela communities in Brazil, which are pretty much urban, but we are still talking about multi-generational families living in the same house, sometimes without a sewage system or water that would help to practice the precautions that we have to take care of now during the pandemic. We also have the peripheries of Brazil, so the expanded centers of Brazil, the metropolitan areas, where people are pretty much not following the quarantine guidelines. And a lot of them doesn't follow the quarantine guidelines because they think the disease is not that serious. Why are, with so many deaths, are people in Brazil still thinking the disease is not serious? Because of fake news and the positionality of the Brazilian president, who says who says that the coronavirus and the COVID-19 is just a flu or a cold, and refuse to create a lockdown or at least a quarantine that is going to be effective. He is still talking to people, going to his supporters, asking people to go back to work, even talking about reopen the places, the public spaces, even in the middle of the crisis. Right now, Brazil is facing the worst time for the pandemic. The fact that this man that is supported by so many Brazilians is denying the fact that the virus is very lethal, make more and more people wish to go outside and party and socialize. So those are a few of the numbers of COVID-19 in Brazil. As you know now, the US government decided to ban Brazilians from Brazil to the US. And we are going to keep you guys posted.